tell us who you are?
Yes, my name is Lauren. I am a board certified, dually licensed funeral service professional in the state of Mississippi.
Okay, and so I was just asking you some questions before of us to figure out what we're going to talk about today. And
Sure.
you had mentioned seeing different things going on during COVID than what your profession looked like prior to
Correct.
COVID. So can you talk about some of those things?
Sure. Prior to COVID, the death ranges, we rarely saw infants passing away. Now there's an excessive amount of that happening. And just the death range from infants to elderly, the increase of young people, the increase of elderly people, it's just mind-blowing, the wave of death that the funeral service industry has experienced. And certainly it's all across the state. There have been lots of need for additional of course, professionals in this industry which just aren't there. So, of course, we feel the burden of that.
Absolutely. And as an embalmer, you said that some of your processes have actually had to change.
Correct.
I'm just curious, and you don't have to answer this if you're not able to, but are you able to see if someone has had the vaccine or not when they come in?
There are some cases that information is given. However, there are cases that it's not given, that information is not given.
Okay. And so you did say you were seeing some irregular clotting and different vascular type issues.
Of course. The past couple of years, there's been lots of irregularities. Prior to 2021, the vascular system pretty much was intact on mostly everybody, that I could go in and preserve the body traditionally via just one point. There are some cases, of course, that were unique. However, as time has gone on, the vascular system has become increasingly difficult to work with. It's occluded. There is, no way to preserve the body traditionally as we once did. We're having to go all over the body to preserve, the foot, the hand. Also, we have a method that we actually use externally when we are unable to use the vascular system for adequate preservation. The whole practice has changed in that area.
And of course, this is anecdotal, but why do you think that is?
Why do I think that is? There's something that's going into people's bodies that is creating something that doesn't belong there. And ultimately, if it doesn't belong there, then the body doesn't know what to do with it. Prior to, whatever's happening here, there are chemicals that we could use to put inside the body that traditionally would break down any blockages that are living in these vessels. Now those chemicals don't work. I'm seeing things that stay intact. They don't dissipate like normal. They keep their integrity, and they pull, and it's not normal.
I don't know if you're able to comment on this as well, but have you seen an increase in younger people's deaths when it comes to different heart issues, myocarditis, or things like that?
Yes. And also, of course, I know people that have developed, those illnesses. So, that are young and should not be experiencing that. Strokes, heart attacks, myocarditis.
Is there anything else you want to tell people about what you're seeing?
I would just like to say that something has changed. and it's affecting a lot of people, and that we just need to think before we just put whatever in our bodies. Our immune system is God created us to have an immune system to fight off illnesses, and I think we just need to think critically before we just insert anything into our body.
Absolutely. And if we do, and of course we're not giving out medical advice, but if we do and we're seeing irregularities, we have to ask, why is this happening?
Yes, why is this happening? And why is this happening? And I need to tell people, and that's why I'm here today, because people need to know that what I'm seeing, because not everybody sees that, is definitely different. The blood is being affected by whatever this is that's going on, and it's killing people. And I just strongly recommend people to think critically before you just put anything into your body.
Absolutely. Thank you for coming today to tell your story.
Thanks.